Omega-3 fatty acids have a fantastic amount of literature behind them. You can really trust that this is something the experts continue to come back to each and every time the question is asked, are omega-3 fatty acids good for me? And they'll always say yes. The question is, what are they good for, and where does the literature stand? Well, good news is marine oils are connected to your neurologic health, healthy aging, even muscle retention. They play a role in your digestive health. They can even play a role in weight loss. A lot of people are surprised to find out that omegas have literature to support them when it comes to healthy sleep. We know they're good for cardiovascular well-being, but did you know they were also profoundly important in your immune system? So when we think about doing a deeper dive and looking into the literature, we want to ask ourselves this question: is the literature or the science just contending that there's benefit, or is the benefit conclusive? What does the expert say? Where is their consensus? Well, we should probably start at the beginning. The impact of marine oils on the body. A fact of the matter is, marine oils, in fact, all essential oils, be they 6, 9s, 3s, they are essential. That means your body cannot make them. You have to take them. You have to get them through diet or through prudent supplementation. Now, when we look at the literature, there's a lot of different essential fatty acids. Today, we're going to focus mostly on ALA, EPA, and DHA. Two of these are marine oils. They are found exclusively in marine fats like fish. Algae is a great example. We're going to go into some of the chemistry behind this so that you feel really comfortable with this. The idea here is that we understand that they're critical for health. They're critical for well-being. Probably beyond cardiovascular health, the most evidence is in cognitive health and well-being. So the question is this for healthy aging: can you get enough through your diet? Do you have to supplement? How much do you need to supplement? And what are some of the best sources for you? Well, literature continues to come out and say, be it 6s, 9s, or 3s, that the 3s, the marine oils, EPA and DHA, are doing the bulk of the good work in helping your body. And this is why a diet rich in healthy, fatty fish, in addition to healthy meats, healthy, of course, fruits and vegetables, complex carbohydrates, even if you are a grain eater, right? It's a diversity of diet that is so powerful for you. But when we want to see what is helping my heart, what is helping my brain, what is helping my muscle and my aging, omega-3 fatty acids are doing a lot of the work. So we know that it's not just about getting a sufficient amount of intake, but also understanding that you can't just take one and expect to get all the benefits from marine fish oils. Why do I say that? Because there are some individuals that will choose to use plant-based oils like ALA, and they expect them over time to become EPA and DHA. And ultimately, that's not what happens. It converts a little bit, but not enough. Sometimes people will make the mistake of taking just EPA and hoping that it becomes enough DHA. And that's not how the physiology or any of the literature works. You need to have a healthy ratio of EPA and DHA because their function in the body is dictated by that ratio. Too much of one tends to work against the other. Not enough of one of them tends to block some of the enzymes that would allow the other to do its job. So when it's cardiovascular health, neurologic health, joint health, and even immune health, we know that there's a healthy ratio of EPA and DHA that needs to be met so that we can make sure that all the tissues in the body that enjoy omega-3 fatty acids have access to those omega-3 fatty acids. Now, I mentioned that we were going to focus a little bit on these omega-3s. EPA, ALA, and DHA. EPA and DHA, these are the marine oils. These are the ones you need to make sure you're getting a sufficient amount in your diet, not just because they're very beneficial for cardiovascular health and well-being, but because DHA plays a very big role in your visual health, in your brain, and cognitive well-being. We know that ALA is a very good omega-3 fatty acid, but it is an insufficient and non-efficient omega-3 fatty acid for cardiovascular health, for brain health and brain development. It's the simplest form of an omega, and it's absolutely prudent to make sure that you're getting ALA, whether it's through flaxseed, walnuts, avocados, that you get that in your diet. But if you want something to support your cardiovascular well-being, your joint health and well-being, your eye function, brain maintenance, or even development of the brain, literature says you need to focus on EPA and DHA, which brings me to omega-6 fatty acids, excuse me. There's a lot of bad information out there about omega-6s, and it simply comes down to this. Too many people, whether it's the Western American diet that we have in the United States, or the fact that we've seen that standard American diet start to move into other countries, most individuals are getting too many omega-6 fatty acids and not enough omega-3s. Now, you may be a fish eater. You may eat a predominant amount of fish. But I want to also point out that aging, activity level, including being athletic, can influence the reserve or the savings accounts that you have of omega-3s. And for that reason, simply by lifestyle, you may be tipping the scales towards an abundance of omega-6 fatty acids and not having a sufficient amount of omega-3s. I bring this up because LA, which is linoleic acid, gamma-linolenic acid, and conjugated linoleic acid, which you are familiar with, all have great health benefits. What we're trying to balance is that arachidonic acid, which comes predominantly from animal flesh or animal fat. Now, many people will say then no beef, no pork, right? No animals, just fish and plants. And that is definitely something that can be a healthy diet, but it's missing the mark. It's possible to still be a meat eater and get a healthy balance of omega-3s and omega-6s as long as you are adding in fish proteins, that you're utilizing plants and micronutrients in your diet so that you can offset that excess of arachidonic acid. Just briefly, CLA is such a powerful essential fatty acid. It happens to be an omega-6, but because of its nature, it is very good at telling fat cells to no longer mature or duplicate. There's great literature, not just on omega-3s, but on some very special omega-6s like conjugated linoleic acid. Now, if diet is one of the best ways for you to take care of yourself, and I believe it is, then we need to make sure that we understand what it means to have a balance of omega-6s and omega-3s in our diet. This should be an example of how you would get a healthier 1.5 gram ratio to every 1 gram of omega-3s in your diet. Your daily diet would have to look something like this. At least 1.5 grams of flaxseed, but probably closer to 3 grams of flaxseed. You can add in some vegetable oils, but be careful how you cook them because vegetable oils can be problematic, especially when you cook them. So ask yourself how you're getting some of these oils and maybe look at avocado oil, maybe look at olive oil, look at some alternative oils like grapeseed oil instead of like safflower or corn oil. Then you'd have to add a serving, at least 4 ounces or 100 grams of salmon or sardines a day. In addition to that, 3 servings of milk fish. So you can see not all fish is created equal. You need quite a bit more milk fish to get the same amount that of omega-3s that you would get in just one serving, or 4 ounces of something like salmon. You can't stop there. To get this balance, we have to make sure that we've got some other healthy fats like eggs and grass-fed beef. If your diet doesn't consist of this kind of variety, you are likely not getting all of the omega-3s in a balance to your omega-6s the way you should. There's other things that may limit your omega-3 fatty acid utilization. How well are you at taking magnesium or eating magnesium-rich foods? Are you zinc sufficient and B vitamin sufficient? Do you supplement with those things, or do you make sure that you get them in your diet? Because without magnesium, B6, and zinc, you can't take a plant-based oil and move it down into EPA and DHA. The same is true for some of those healthy omega-6s. In the absence of good micronutrients in your diet, you just don't have the cofactors to push even good omega-6s down into healthy anti-inflammatory fats. As a result, you'll create more arachidonic acid. Individuals that are above the age of 60 carry extra weight around their middle and their hips, or individuals that drink alcohol also deplete their body's natural ability to ultimately elongate EPA or fatty acids into EPA and DHA, or healthy omega-6 fatty acids. So we have to pay attention to a few things like diet, lifestyle, age, how you cook your fish matters. There's a high variability in omega-3 fatty acid concentration in any one fish. So go to the source and get some healthy marine oils through a heart healthy omega-3 supplement. Now, as I said earlier, at the end of the day, experts don't ask if omega-3 fatty acids are good for us. They know they are. They just ask, where should we be applying them? What is meaningful? Well, studies show that individuals that have a diet high in fish or omega-3 fatty intake through supplementation these individuals are associated with the lower risk of heart disease. In fact, as we go through the literature on cardiovascular health and cardiovascular disease, it's truly conclusive that omega-3 fatty acids play a role in blood pressure, maintaining healthy blood pressure, as well as healthy oxygen and blood flow through the heart. Omega-3 fatty acids are exceptionally well regarded in their ability to support healthy triglyceride levels. Even small amounts of EPA and DHA added to somebody's diet that has not been getting enough can have a very good boost in their cardiovascular health. In fact, clinical studies show that omega-3 fatty acids preferentially support your good cholesterol while making sure that there's not oxidation to your bad cholesterol. Paying attention to other factors like antioxidants in your diet and supplementation will also assist omega-3 fatty acids doing this job for you. Now, what about cognitive health and well-being? Well, marine oils go hand in hand with your cognitive health. I often say anything that we did to support brain development in an infant, we need to consider doing in brain maintenance in an older individual. And omega-3 fatty acids are the common currency. They are what we always want to make sure that breastfed mothers are consuming so that babies' brains and eyes are healthy. But these are the same omega-3 fatty acids that we want to take through life, as well as into our later decades of life, so that we can support our own cognitive function, our own visual function. You can see here that EPA is profoundly beneficial in mood and cognitive support, that there's benefit in attention, behavior, focus, clarity of mind with individuals that utilize omega-3 fatty acids. We find that brain function and visual function is highly reliant on making sure that you have enough DHA. In fact, DHA is doing a lot of the work in mother's milk and in mother's well-being while she is pregnant with her infant. We find that the literature is very supportive of omega-3, EPA, and DHA for building blocks for the baby's brain, their eyes, their nervous system, absolutely critical to their cognitive well-being and their development visually as infants. We find that women that consume omega-3 fatty acids during pregnancy, in particular DHA, have babies with better sleep habits. They've babies with better birth weight. And this is why it's so important for us to get started at the very beginning by making sure that mom and baby have a sufficient supply of omega-3 fatty acids. As our babies become toddlers or as we become adults, we have to understand that DHA is essential to the construction of our brain and the maintenance of our own cognitive well-being, our own academic performance, our own visual performance. We know that omega-3 fatty acids are very beneficial in children with attention and focus concerns, that women that utilize omega-3 fatty acids during pregnancy have babies with less attention issues or focus issues. But we also know in much later years, individuals that are concerned about mood often do very well when they use omega-3 fatty acids. Studies show both alone omega-3 fatty acids are beneficial for mood. I will add that multivitamins are also profoundly beneficial when it comes to mood paired with omegas. But individuals that are utilizing prescription medications tend to respond better to those medications when they're also using an omega-3 fatty acid recommended by their healthcare provider. When we look at cognitive health, too many people think this is something just to be concerned about in your sixth, seventh, or eighth decade of life or beyond, when in fact, omega-3 fatty acids are very beneficial for memory and reaction time, even in young individuals. Looking at this study here, individuals between 18 and 45 years old had better spatial memory as well as volume of the brain when they were getting adequate omega-3 fatty acids. So it's important to note that omega-3 fatty acids can be tracked by what we would refer to as a brain age. How young is your brain? Omegas play a role in that question. When we look at cognitive health as well as mood, we know that individuals that have a sufficient to high intake of omega-3 fatty acids do report better on behavior scales, on mood scales, and quality of life scales. We know that omega-3 fatty acids are critical through all decades of life, and that this is something that should start in pregnancy with mom, but also be focused on in how are we making sure our kids are getting healthy fats, because it's the EPA and DHA, strongly DHA, that is responsible for that academic performance, that cognitive health and well-being, making sure that we can stay concentrated in a very hyperactive, very hyperstimulated world. Which brings me to vision. How many of you are spending a lot of time in front of a computer? Well, during that time, there's a lot of visual hyperactivity going on. It's not just about blue light and protecting ourselves throughout the visual spectrum, but also making sure that your eyes have a sufficient amount of omega-3 fatty acids, whether you're concerned about dry eyes or you're concerned about blood flow to the critical tissues in your eye, like the retina or the macula. Vision and omega-3 fatty acids are really important because when we look at where DHA is concentrated in the eye, it is concentrated throughout the retina, and it is considered one of the more beneficial components of retinal tissue to support eye health through all decades of life. We find that individuals that have low dietary intake of DHA also have lower visual function or visual acuity, because visual acuity can start to leave us as we age. As we are overly straining our eyes, we need to make sure that we're thinking from a youth standpoint, from an overuse standpoint, and from an aging standpoint, that we are adding in omega-3 fatty acids. There's fantastic and growing evidence that omega-3 fatty acids can be very protective in something called age-related macular degeneration. Because with age, we do see more damage to the eyes. Some individuals will notice this as dry eye, as I mentioned. This is where omega-3 fatty acids can be very helpful. Other places to consider beyond dry eye or just visual acuity is that there are studies to support omega-3 fatty acids in the care of individuals that are concerned about eye pressure or glaucoma. What about your immunity? That's really on everybody's minds. What else can I do to support my immunity? And the idea here is to build a better foundation. Omega-3 fatty acids like EPA and DHA are critical to the development and performance of your immune cells. EPA and DHA are precursors to bioactive lipids that we refer to as pro-resolving mediators. What that means is that omega-3 fatty acids play a role in not just the maintenance and support of an anti-inflammatory environment, but when there's already an inflammatory environment, maybe due to age, to stress, immune dysfunction, or an immune response, or athleticism, that's another great example, that omegas can come in and resolve that and stop persistent low-grade inflammation. And that's where a lot of people overlook their need for omega-3 fatty acids, because most of us are living in a toxic world. We are overly stressed and underslept and not always well fed. And that means that we have low grade, persistent, and prolonged inflammation. And we know that if you've got to do something about that, omega-3 fatty acids are the first place you should start. I want you to get a good night's sleep. I want you to get a healthy diet. But when we think about what could you do right now and have a meaningful impact, omega-3 fatty acids are one of the things I would recommend. Because whether you are detoxing, whether you are a fitness fanatic, you're concerned about aging joints or digestive health, perhaps you are concerned about your skin health, omega-3 fatty acids are able to support each one of these areas of health and ultimately your longevity. Thank you for spending time with me today to do a deeper dive and a closer look at the science behind omega-3 fatty acids. Until I get to see you again, go be healthy, go be brilliant.